Welcome to my channel. Today in this video we will discuss about coronavirus and influenza virus. Now there is a common question regarding the coexistence of COVID-19 and influenza virus in the same individual. This question normally arises in our minds that if a person has COVID-19, can he be infected with influenza virus or not? Or if he is infected with influenza virus, can he be infected by coronavirus at the same time? So we will discuss here in this video. Normally in winters, so many viruses which cause common flu like influenza virus A and B, respiratory syncytial virus, adenoviruses, rhinoviruses and so many other viruses. These viruses got multiplied many folds in winters. So there is a possibility that the same individual may get coronavirus and influenza virus at the same time. And the second question arises that if a person contracts these two viruses at the same time, can he be infected more than the person who contracts either corona or influenza virus? So the answer is yes. A person who contracts these two viruses together at the same time is affected more than the one who contracts these viruses at different times. The reason is both these viruses infect the lungs, but important thing for us to remember is just like coronavirus which affect other organs of the body, the flu virus also affects heart, muscles and other parts of the body. And this flu virus also causes ARDS, or it can cause systemic inflammation, which is called inflammatory response syndrome. And if a person contracts both these viruses, he may get all these complications. That's why doctors recommend to try to prevent yourself from contracting the flu virus, because it's easy to prevent yourself from getting the flu virus. Since the symptoms of coronavirus and flu virus are very similar, like in adults they have fever, cough, body aches, shortness of breath, fatigue, these are all common symptoms. But the difference between these two viruses is that the children usually get diarrhea and vomiting more commonly. And in adults, there will be loss of taste and smell more commonly as compared to the adults having flu virus. Besides these, all have almost same symptoms like fever, cough, body aches, sore throat, blocked nose or running nose, fatigue, and loss of sense and taste are particularly found in COVID patients. Now, how we differentiate between these two? We will perform a test called PCR because it's very important to differentiate between these two viruses. Now, how can we prevent from coronavirus? Because in winters, if more people get infection with flu virus, there can be a panic situation. And obviously, in our country like Pakistan, we don't have adequate facilities for testing. Since when COVID started to rise in Pakistan, winter season was about to end. So we take the example of a country where COVID cases started to rise in winters. So what was the impact on flu? Like for example in Australia, where people were already taking precautionary measures like hand washing, social distancing and wearing masks. So the flu cases dropped significantly. But how did they know about it? It's because in last winters, more than 100,000 people were infected with flu. But in recent winters, only 107 people got infection with flu virus. So to prevent yourself from both viruses, you have to observe all these measures. Secondly, we have to keep in mind that COVID vaccine is not launched yet. And because of its side effects seen in trial cases recently, it's unlikely to launch this vaccine in very near future. But the good news is that the flu vaccine has no side effects. So, babies more than 6 months should be given flu shots. First possibility after taking flu shot is that they may not get flu. But even if they get flu, its severity will be very mild. Now people with diabetes mellitus, increased blood pressure, hypertension, advanced age, some kidney diseases, COPD, asthma or any other immunocompromised patient like for example cancer patients, they should take flu shots till October because patients with these chronic diseases, even if they get flu virus, that's influenza virus, they may progress to pneumonia within a week and they may end up on ventilators. The other difference between coronavirus and flu virus is that if flu virus gets into your body, you start developing the symptoms soon. But around 40% of patients who contract coronavirus are usually asymptomatic, so this is dangerous. And they spread the virus. If you are young and you have a good immunity, you might not need a flu vaccine this year. But the elders and the children who have weak immunity, they must take flu shots because it may cause severe problems if you contract both of these viruses together. So, and this is now getting a new terminology called twindemic, meaning it's making more problems. So better to prevent yourself from any of these two by taking all the physical measures. I hope you enjoyed this video. Thank you for watching.